Hello, my love. Take a seat. I'll get this on. How are you today, Puppet? Good. Okay. So you're here for a cranial nerve examination. I see. Okay, well, I do my cranial nerve exams a little bit differently to perhaps any doctor you've seen before. I think we get the best out of our patients when you are relaxed, calm, and so I'm going to just really softly speak to you with whispers and soft spoken. We're going to take our time. We're going to do the assessments, make sure you're okay, and go from there. Does that sound okay? Okay. You happy with that? I do have some questions to ask you. Yeah, just to give me a little bit of an idea as to why we are looking at you today and examining you today. Okay. Alright. So, can you just confirm your full name for me? I see. And the first line of your address. And a mobile number that we can contact you on. Wonderful. Now tell me a little bit about your injury that you feel you've sustained today. So you fell and hit your head. You poor thing. We'll just check your head as well. We'll just make sure everything is fine. Have you got a little lump there as well? I'll have a feel around your scalp in a moment. Okay, so you fell downstairs and bumped head. Have you had any visual disturbances since? Yeah, so what I mean by that is any sort of stars in your eyes, maybe black patches, perhaps more floaters than normal. Okay. Have you noticed any issues with your memory at all? Yeah, like forgetfulness or even just brain fog, anything like that? Okay. Alright. Do you have any headaches? Or have you been sick or feel sick? Okay. Well, we'll certainly have a look at you today. Do a full cranial nerve examination and make sure things are in, working order. And I'm sure it will be absolutely fine. But I will be super thorough to make sure, okay? Alright, let me just take a quick look at you here. feeling around for any lumps. Where did you say that? I see here. Okay. I see. Okay. Alright. Let me just take a quick heart rate read from you, okay? Let me just have a listen. If you just lift your top up slightly for me, that's it. It might feel a little cold. Okay. Let's do your blood pressure as well, just to make sure it's okay. Okay, I'm just going to put that on this arm here, just below your arm 3. That's it. Okay. Do that again. And one more time. Okay. So just remove your arm for me. That's it. Yep, that's it. We'll just take the air out of this before I move to it. Okay. No, your blood pressure is fine. Not to worry at all. It's all okay. Alright, now I've got your vitals out of the way. We're going to begin with your sense of smell. Okay? So it's your olfactory nerve. Alright. So we're going to use this for this test. Okay. Now, it's a variety of essential oils. And I want you to tell me what you can smell. It might be that you can't quite get the name of the scent, but you can describe it. That is fine as well. Okay. Where are we? It's getting a little bit choked. There we go, that's better. Okay, let's begin with this one. Alright, I'm just going to run this past your nose. Okay, I want you to breathe in deeply, in and out. Okay. What can you smell? Alright. Yes, it was cinnamon. Okay. Our next one. Just going to pass it under your nostrils. What was that? Citrusy. Lemon. Yes, it was lemongrass. Same thing, pretty much. So that is fine. Okay, our next one. Just gently running that under your nose. Yes, it was lavender. There's not much left in that one. Okay, let's try something a little bit different. See if you can pick this one up. Similar. Yes, it is a rose. Okay. How about this one? Just describe it for me. Yes. Of course. Yes. That kind of medicinal smell. That's a bit like deep heat. Eucalyptus. Let's do one last one that's a little bit different. Okay, make sure that you're smelling all the categories. Just breathe in deeply, that's it. What can you smell? Quite herby. That's fine. It's hard to get it in the oil form, but it's rosemary. Might remind you of cooking. Yes. Alright, well that was great. No issues at all with your sense of smell. So I just note that down for you. So I'll check some smell test. Alright. Okay. We're gonna move on to your eye test now, okay? So we're looking at your optic nerve here in a variety of ways. Okay. Now I'm going to do a quick examination just of your pupils, so if you can look up for me. Right. And then, okay, to your right. And then to your left. And then up. And down. To the right. And to your left. Okay, I think that's fine. I'm just going to quickly flick the light at you. I'm just looking at how your pupils respond. Okay. Alright. I'm going to cover your right eye, and I want you to tell me when you can see my finger come into view. Okay. Alright. Okay, and on the other eye, just remember to look straight ahead, okay? finger. Again. And one more time. Okay. Alright, I'm going to hold up this Snellen chart and I want you to read it for me starting from the top, okay? E L D F P H O L C F D H J B S E P T Z O C F D H J L D F P H. Well done, that was really great. You got all the way down there. Okay, we're going to take a look at some colorblind tests as well. So, could you tell me what number this is? Alright. And the number in this one. Okay. This number. Alright. This letter. This letter. The shape. And the shape. Excellent. Alright. Perfect. Now we're going to have a quick look in your ears and make sure everything looks okay before we begin our ear test to check your hearing. Yes, with the nerve that's involved in the hearing process, okay? Right, I'm gonna look at this ear first, okay? I'm just gonna go in here. Like so. Alright, that's fine. Okay, and that's one look in your other ear. Okay. Alright. All looks good. We're going to do the tuning fork test. Okay? I'm going to do it 3 times and you need to let me know when you can no longer hear the sound, okay? action test. So I'm going to massage one ear, make a sound, a noise, and then I'm going to whisper words into your other ear, and you just need to let me know what I've said, okay? Start with this ear. Sandwich. Costa. Mean. Road. Starfish. Donut. Carpet. Great. I'll do this with the other ear. Cheese. Diffuser. Tankard. Shirt. Love heart. Pineapple. Microphone. Great. Your hearing is all good. So your eye test and your ear test were excellent. So we're going to move on to your touch test. So I'm going to touch quadrants and areas on your face with a very soft touch. You have to tell me if you can feel it. And then with a slightly harsher touch, it's very light. And it'll be more of like a prick. It's not sore. But it will activate your pain receptors and a different neuron pathway, which we want to be able to see is working correctly, okay? So we'll start with the soft. Great. Now for the prick. Great, well done. Now for our last set of tests. It's all about movements. So we're going to check your reflexes on your knee to begin. So if you just keep sitting there, and I'm just going to bend your knee. There we go. And the other side. Perfect. Alright, if I was to put my hands on your shoulders. Okay, now I want you to shrug your shoulders against the resistance. Okay, just that's it. And again. One more time. Okay, if I put my hand here, I want you to turn your face towards my hand against the resistance, okay? So try, that's it. Again. And again. Excellent. On the other side. That's it. And again. And again. Right. Open your eyes nice and wide for me. And that's it. Just stick your tongue out. Move it from side to side. close your mouth again. Now I'm going to put my hands on your cheeks and I want you to blow your cheeks out against my hands. Great. Okay, and how are your shoulders moving? No issues. Excuse me. Can you swallow for me so that I can see your masseter muscle and trapezius? Yeah. Okay, that's all fine. And obviously your features. If you could smile broadly for me, big smile. Yep, and raise your eyebrows. Can you scrunch your eyes closed? Okay, excellent. Alright. Will you be pleased to know that it appears all of your cranial nerves are in a perfect working order. So despite having that fall and the little bump on your head, it doesn't look like you've damaged anything internally. Yes, you'll be so relieved to know that. So you're perfectly healthy. And that's exactly what we want to see here. Do you have any questions for me at all? Yes, I would recommend, if you're still feeling sore head, take some paracetamol if you can. Make sure you rest. Drink plenty of water. If you don't feel up to anything, that's totally fine. You can just rest, have a nap. Try and get a good night's sleep. It will do you the world of good. Try and not focus on anything that's stressful or makes you worry. Let's just try and relieve all those worries and stress and leave it for another day. Yeah. Okay. Alright. Well, that is your session complete. Okay. Well, it's a pleasure to have met you and to have looked after you today. You can take the door on the right to the reception for the way out. Okay.